Hi, I'm Jon Kerner. I'm chair of the Primary Prevention Action Group and senior scientific advisor for cancer control and knowledge translation at the Canadian Partnership Against Cancer. Well, when Health Canada decided to invest in the implementation of the Canadian Cancer Control Strategy and created the Canadian Partnership Against Cancer to do that, a key focus of the Canadian Cancer Control Strategy was primary prevention. In fact, in the partnership's portfolio, primary prevention is the second largest investment after research. And so there are many risk factors: behavioral, social, environmental, clinical risk factors for cancer. But one of the big ones, and one of the ones that's moving in the wrong direction here in Canada, is obesity. And so when Diane Finegood, who was the former chief of the Canadian Institute for Health Research Institute for Nutrition, Metabolism, and Diabetes, approached the partnership about working together, we were very excited about the prospect of working with Diane around her ideas about collecting information about what was going on in the real world to try and address obesity and other risk factors. What the partnership found so compelling about Diane's idea, which turned into Capture, was two things. One is the partnership's all about integrating science with service and research with practice and policy. And so a key issue there for us is how do we take the lessons learned from science and make sure they're translated into practice and policy. But equally important, and this is the key focus I think that compelled us to get interested in Diane's idea, was the idea of how do we capture, so to speak, what's actually going on in the field and learn the lessons from practice and policy that ultimately can increase our knowledge base. And so this is why the focus on Capture became a real interest and a real strategic investment for us. What makes Capture truly unique, in my view, is its focus on the taking stock of what actions are being done in Canada, what can we learn from that, what data can we collect, and how can that inform new policies and practices based not only the lessons learned from science, but the lessons learned from real-world evidence. The risk factors for cancer that are preventable are also the risk factors for many other chronic diseases. So when we talk about primary prevention of cancer, we're also talking about primary prevention of lung disease, we're talking about primary prevention of heart disease, and we're talking about primary prevention of diabetes. Many of those diseases are related to key risk factors like obesity. So the challenge for us is how do we work together in partnership with other organizations and leaders in Canada who are interested in this kind of chronic disease prevention area. Thus the Capture project, which is trying to collect the information about what is going on out in the real world to address chronic disease prevention, became an exciting opportunity for us to work together across chronic diseases to address what we can learn from the actions being taken in Canada to reduce the impact and burden of chronic disease and cancer in our populations. So for the past year or so, actually for the past 9 months, the Capture project has really reached out to many of the experts in the area of chronic disease prevention, measurement, information technology, and tried to sort of pick their brains to find out what were some of the challenges that Capture was going to face, and also what had already been done to try and not duplicate what others had done, but really build on it. So in that sense, I think the Capture project has made great progress. I also think they recognize, and we recognize at the partnership, that there are many challenges that lie ahead. And so we have a lot of work to do to make the vision of Capture a reality.